Cruise. The ocean. Serenity. A luxury expedition to the edge of the world, for 147 people turned into a gripping maritime thriller, that today has triggered a global biological alert. On April 1, 2026, the Dutch cruise ship MV Hondius departed from Ushuaia, the southernmost city on the planet. On board were tourists and researchers dreaming of seeing the most remote corners of the Earth. The icy expanses of Antarctica, the lost islands of the South Atlantic, and the endless ocean where civilization seems incredibly far away. The route looked like the script of an adventure movie. Argentina. Antarctica. Tristan da Cunha. St. Helena Island. Cape Verde. And the final point, the Canary Islands. But just a few days later, the journey began turning into something completely different. On April 6, one of the passengers began feeling unwell. At first, everything looked like an ordinary cold. Weakness, high fever, symptoms similar to the flu. On a huge ship in the middle of the ocean, nobody saw any reason for concern. However, on April 11, the situation changed dramatically. The passenger died directly on board. The death was considered natural. No quarantine was introduced, there was no panic. The cruise continued. People still went ashore on remote islands, attended lectures, photographed icebergs, and enjoyed the journey, not even suspecting that danger might already have been spreading among the passengers. Some time later, symptoms appeared in the wife of the deceased. Her condition rapidly worsened. The woman was urgently evacuated to Johannesburg, but she could not be saved. When laboratories received the test results, it became clear. This was not the flu. Doctors confirmed the presence of Andes hantavirus, a rare and extremely dangerous virus widespread in South America. What caused special concern was something else. This is one of the few types of hantavirus that is supposedly capable of transmitting from person to person. On April 24, the liner arrived at St. Helena. Some passengers managed to go ashore. The body of the first victim was removed from the island. It was at this moment that a local tragedy turned into an international threat. Passengers began flying to different countries even before it became clear what exactly doctors were dealing with. Health authorities in several countries urgently began tracing contacts and possible chains of infection. The expedition that began among the glaciers of Antarctica unexpectedly became the subject of a global healthcare investigation. When the vessel later arrived in Praia, the situation already looked completely different. Authorities feared an outbreak of infection on board. The liner effectively ended up blocked off the coast. Passengers were isolated in their cabins. Medical teams boarded the vessel. Large-scale disinfection of the ship began. Critically ill patients were evacuated under the supervision of doctors. Somewhere between Antarctica and Africa, the luxury expedition voyage turned into a floating quarantine zone. And then the whole world asked the question: could the spread of this virus escalate into a new global pandemic? But what exactly is hantavirus? Unlike COVID-19, this virus does not spread rapidly through megacities, airports, or mass events. Most people have never even heard of its existence. And yet, in severe cases, hantavirus is capable of killing with frightening speed. Hantaviruses are an entire group of dangerous viruses primarily carried by rodents, especially wild mice and rats. Most often, people become infected without even realizing it. Sometimes it is enough to inhale dust contaminated with the urine, saliva, or droppings of infected animals. This can happen while cleaning an old shed, an abandoned cabin, a storage room, or a long empty building covered in dust. In rare cases, the virus can also be transmitted through rodent bites. Most known hantaviruses are not capable of spreading between humans. But in South America, researchers encountered a disturbing exception. A strain known as the Andes virus. It is one of the few hantaviruses ever suspected of limited human-to-human transmission. That is exactly why the outbreak aboard MV Hondius caused such serious concern among specialists. However, the history of hantavirus began long before modern investigations. Decades ago, doctors in different countries encountered mysterious illnesses whose origins nobody could explain. Patients suddenly developed high fever, severe muscle pain, internal bleeding, kidney failure, or rapid lung collapse. Many died within just a few days. At the time, the disease was often confused with influenza, typhus, plague, and other dangerous infections. But the real turning point came during the Korean War. In the 1950s, thousands of soldiers stationed in rural areas of Korea began falling ill with an unknown disease. The symptoms were terrifying. High fever, severe back pain, bleeding, and serious kidney damage. Doctors called it Korean hemorrhagic fever. But the disease had one strange characteristic. Nearly all outbreaks occurred near trenches, military camps, and areas with huge numbers of rodents. At that time, nobody yet understood that mice were the source of the infection. Only in the 1970s did South Korean scientist Ho Wong-Lee achieve a real breakthrough. He isolated an unknown virus from a field mouse captured near the Handan River. It was after this river that the virus received its name, hantavirus. This discovery changed scientists' understanding of the disease. Researchers quickly realized different species of rodents carry different strains of the virus. Later, similar viruses were discovered in China, the Soviet Union, Scandinavia, and the Balkans. In Europe and Asia, the infection more often affected the kidneys. But in the United States, the virus revealed itself in a much more terrifying way. In 1993, in the Four Corners region of the southwestern United States, young and completely healthy people suddenly began dying from severe respiratory failure. At first, authorities feared anything: a new influenza virus, chemical contamination, or even a biological attack. But the investigation revealed an unexpected detail. Almost all of the infected individuals had recently been in contact with rodents. Later, scientists identified an entirely new strain of hantavirus. It was named sin nombre, without a name. It was then that the world first learned about the disease now known as hantavirus pulmonary syndrome. But researchers discovered another important pattern. Shortly before the outbreak, the region experienced unusually heavy rainfall. More rain led to increased vegetation. More vegetation led to a sharp increase in the mouse population. And more mice led to increased contact between humans and infected rodents. This became one of the most famous examples of how environmental changes can directly influence the spread of dangerous infections. Later, new hantavirus strains were discovered across South America. In Argentina, Chile, Brazil, and Paraguay. One of the most dangerous and closely studied variants became the Andes virus itself. The very same strain now linked to the outbreak aboard MV Hondius. Today, hantavirus remains a rare disease. But its main danger lies elsewhere. A patient's condition can deteriorate within just a matter of hours. At first, the symptoms appear almost harmless. Fever, headache, fatigue, muscle aches. But then the lungs begin rapidly filling with fluid. Breathing becomes difficult. Oxygen levels drop sharply. Severe lung damage develops, resembling pneumonia. Many patients end up in intensive care and require mechanical ventilation. Unlike COVID-19, hantavirus usually does not cause global pandemics and does not spread around the world. Human-to-human transmission is considered extremely rare. But in severe cases, the fatality rate can be significantly higher. And there is another serious problem. To this day, there is still no widely available medication specifically designed to destroy the virus. Doctors can only support the patient's body. Oxygen therapy, intensive care, mechanical ventilation. In South American countries, especially Argentina and Chile, authorities regularly warn residents about the danger of infection after rainy seasons, when rodent populations sharply increase. Today, scientists are certain. Humans are not the natural host of the virus. Rodents can carry hantavirus for years with almost no symptoms. Humans become accidental victims. And sometimes, an accidental outbreak in one of the most remote corners of the planet can unexpectedly turn into an international crisis. Today, the vessel MV Hondius is still continuing its journey across the Atlantic. But now this is no longer just an expedition cruise. According to the latest reports, the liner has left Cape Verde and is heading toward Tenerife. The expected point of arrival is said to be the port of Granadilla de Abona. On board, around 150 passengers and crew members remain under medical observation. According to available information, many people have remained isolated in their cabins for several days. The situation on the vessel is described as calm, but under strict control. Medical teams continue examinations while international health services coordinate further actions. As of May 8, 5 cases of hantavirus infection linked to this voyage have been officially confirmed. Several other cases are still being investigated. 3 people have died. But the concern of the international community is caused not only by the numbers themselves. The main reason for concern is the suspected connection of the outbreak to the Andes virus. This is one of the very few hantavirus strains ever associated with possible human-to-human transmission. Compared to COVID-19, this virus is considered significantly less contagious. The World Health Organization states that the risk of a global epidemic remains low. Experts emphasize that close and prolonged contact is likely required for transmission of the virus. But there is one detail that continues to seriously concern specialists. The incubation period of the virus can reach up to 45 days. And this means that an infected person is capable of crossing countries and continents even before the first symptoms appear. By the time the virus was finally identified, passengers from the liner had already dispersed to different parts of the world. Authorities in the United States, United Kingdom, Netherlands, Germany, Switzerland, and Canada have begun large-scale contact tracing connected to this voyage. The situation is being closely monitored by international organizations, including the World Health Organization and the European Centre for Disease Prevention and Control. Researchers are now trying to answer several key questions. Did transmission of the virus occur directly on board? Were some passengers infected even before the cruise began? And could the virus itself have somehow changed? Meanwhile, Spain is preparing for one of the most unusual sanitary operations of recent years. According to preliminary information, the vessel may not be allowed to dock directly in the port of Tenerife. Instead, the liner will likely remain offshore, while passengers are brought ashore in small groups under strict medical supervision. Some countries have already begun organizing special repatriation flights for their citizens. On May 8, the company Oceanwide Expeditions reported that at the moment there are no passengers on board with active symptoms of the disease. The company also stated that the crew and guests continue following all medical procedures under the supervision of specialists. According to company representatives, quarantine measures, examinations, and further actions are being coordinated jointly with Dutch authorities, Spanish services, and the World Health Organization. But while official structures are trying to understand the situation, the internet has already begun living its own life. On social media, users are massively spreading an old post from 2022 that allegedly mentioned a hantavirus outbreak specifically in 2026. There is no evidence connecting this message to real events. However, against the background of an international outbreak, conspiracy theories are spreading almost as quickly as the news itself. Despite everything happening, health officials continue to insist that the situation remains under control. But the story of MV Hondius has already become one of the most unusual episodes related to infectious diseases in recent years. A deadly virus. A vessel in the middle of the Atlantic. Passengers scattered across the world. And scientists who are still trying to understand what exactly happened in the middle of the ocean.